Hello and welcome to Embracing Senior Health, sponsored by Embrace Hospice. I'm your host, Candace Howell, and today we're going to focus on assisted living. We're going to learn more about assisted living and why it's so important to all of our lives. I'm joined now by Charlene Hope, and she is the Chief Nursing Officer for Embrace Hospice. We also have Dave Jones, and he is the Executive Director at Morningside Assisted Living, and Janice Flecknoe, and she's the Executive Director at Anderson Oaks Assisted Living. Thank you all so much for joining us. Appreciate having you. This is a really important issue in all of our lives, no matter what stage that we're at. So today we want to talk about exactly what assisted living is. So kind of break it down for us.
Assisted living is a residential option for seniors who need assistance or want assistance with activities of daily living, as opposed to having to go to a nursing home, where you've got 24-hour medical care or nursing supervision. Our seniors basically just need a little less assistance.
And I think that's one of the things that a lot of people don't really understand, the difference between the true nursing home and then the assisted living facility. So the other thing too is, why should people be looking into this and looking into it very carefully?
I think assisted living, one of the differences between assisted living and a skilled nursing home is assisted living is a social model, and the skilled nursing home is, as David said, a medical model. When someone stays at home, they kind of get to the point where they see who they see. They start losing that ability to socialize. When they say, if you don't use it, you're going to lose it, it's not just talking about physical, it's talking about mental, and that socialization is a very big part, of their well-being.
And exactly when is the right time that we need to be starting to look at this? And we'll talk about in a moment who should be looking at it too. So when we think about when, is there any set time in our life that we really should be considering this? Because for me right now, I probably need to be starting to look at this maybe for my grandparents and my parents in the not too distant future.
We as people need to look at it when we're young. Long-term care health insurance. If we buy it at age 25, it's not going to cost us as much as if we buy it at age 70. So it's not just because we're getting older and elderly. We should be looking at it as the young age and our options of our health care and our well-being for the future.
I think so many of us get to a point into our life where we're like, well, we're healthy, we're good right now, but how slippery of a slope does that become?
It is, because, what people don't realize, nobody looks into the future. I know as I get older, the things we were talking about before, I used to play 2 games of soccer a day. I'm lucky if I can get up and down the field now, as I get older. So I think that people need to start looking. What generally happens is siblings, mostly daughters-in-law, go see mum, dad, and notice that they're not eating as well, they're losing weight, they're forgetting to go to the doctors, they're forgetting to take the medication. And then they began to realize something should start to happen now.
And that's you mentioned too. Who is the other thing? Do you see coming in to start asking the questions? So we said daughters and daughter-in-law, sons, son-in-law. I think a lot of people don't want to have to cross that bridge either, because we know we're going to come back, and whoever it is that we're looking into it is going to probably do this a little bit. How does that work, and how do you counsel people through that?
It's a tough situation. I think that's one of the biggest questions, saying, well, they're not excited about this. The truth of the matter is, most people aren't. I have had, honestly, in my career, 20 years, maybe a handful of persons that were jumping up and down for joy and couldn't wait. At Anderson Oaks, we do go above and beyond. We understand that it is a hard transition. They are giving up independence, things along that line. We do invite them to come for lunch, come for social events and things like that beforehand, so they can see it's really fun. We're the only not-for-profit assisted living in the state, and so we can give them a lot of different things, which I'm sure we'll get to in the future, but it is a hard situation. We allow them to move their things in, this family to set up their unit 2 days beforehand, and we don't charge them for that. We want that move-in time to be as successful thing. I try to remind my staff that how they felt when they were new. We have a welcoming committee of residents, so they go and try to make them feel welcome too. And it does work pretty well, but it is tough. It is.
Dave, same for you guys with your facility?
Yeah. As you know, we're saying that they're giving up independence, and you have to keep saying, you know, you've got to keep the dignity. It's very important, and you know, all of the things that in their house that they remember that is going to shrink into small rooms. But you know, if they bring all of their favorite possessions, and that's huge for them to do.
True.
You know, and we have to understand that's happening to them. You know, and it's difficult for them to accept. You know, I'm going to make this change, and so we have to make life as easy as we can for them, and then make it as homey as you can. You know, and that's why I think we're all the same way.
Yes.
Is that all our staff, you have to be, your passion has to be people.
Yeah, and really personalizing it. I think you mentioned that too. I think that's really important. I remember not too long ago my great aunt going into a facility in upstate New York, and at first she was a little apprehensive, but at the same time she knew that she had this large house that she could no longer take care of, and she's still a very independent woman. But she got there and she got situated and made her little apartment her own and began being more social than she'd ever been, you know, really in the last 20 years of her life. And I saw the transition very early on with her from I'm apprehensive to this isn't so bad, I think this is going to be great. Well, we've got more coming up. We're going to continue the conversation on the other side of the break. We'll be focusing then on the services of assisted living when we come back. Stay with us.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey.
Welcome back to Embracing Senior Health on WMBF News. This is a great show where we're talking about assisted living today. You might have a lot of questions if this is something that you're looking at for someone in your family right now. And I'm joined again by Charlene Hope, Dave Jones, and also Janice Flecknoe. And again, we're talking assisted living, and this is such an important part of all of our lives. And so what we really wanted to get into in this portion of the show is what exactly is provided once you're at the facilities? What's there? What is there to do? Let's talk about that.
Well, we provide assistance of daily living activities, assist with showers, dressing, things like that. Anderson Oaks has an all-inclusive rate, which is different than most, so it's a flat rate, and it includes their room, their whatever assistance they need, their meals, laundry, housekeeping, and we have an abundance of activities to do. Tuesdays they go out for a lunch outing, Thursday they go out shopping, they're getting ready to go to the Patsy Cline show, so they go to the beach. We get season passes to the beach. Usually 6 to 8 times a month we have an outside entertainer that comes in. We have band night every other Monday night. So there's crafts, scrapbooking. We have a gardening club which is getting their garden ready right now. So we just have an abundance of things for them to do, keeping them busy.
And Dave, paint me a picture of what it's like for you guys.
Yeah, it's same thing. Basically, that we do, like you also do, you know, your transportation, you do take people to and from the doctors or out sightseeing or down to the store to do things like that. And we've actually just created a mini cinema. So it can be big screen TV, popcorn machine, the ice cream, the drinks, you know, the whole thing. The other things that you do need to make sure when you do is hydration is huge in our business, especially in summer when people are out sitting. You know, you got to make sure they get out and get liquids, it's so quick. It can happen so quickly for people to just, you know, go under if you don't keep them hydrated. But we do same thing. Then, you know, make sure they get all the snacks. One of the things we have to watch for, a lot of the people in our particular community have started putting weight on. We have a chef and he's great. I stopped eating there.
Yeah, and that brings me to my next point too. Charlene, what have you always heard about the food at assisted living facilities? I've always heard pretty good things. As a matter of fact, we used to do a show here called Local Living, and we had a chef once from an assisted living facility, and he cooked for us, and it was really, really good. I mean, we had a line out the door.
It is good, and I've eaten there. They have many occasions that they invited us to, and it's excellent. Like Dave said, I would not want to eat there all the time because I'd probably gain weight. And you see some of the residents do gain weight.
Yeah,
so
and
we
I'm sure
need to be careful
right
with
there
that.
With them. Yeah,
Right.
Absolutely. So let's talk a little bit more about some of the activities, because I think that's a big selling point too. So you have folks that are researching your facilities, and they're coming in and they're saying, why your facility over yours? And they all have great activities, but why are the activities so important? We talked a little bit earlier about socialization. Talk about how you see that kind of flourish within the facilities.
I think at times people become dormant, you know, in their homes. Things that they may have loved to do in the past, they're just not interested. Once they come into our community, we do introduce, they see the other person's doing it. It does keep them active, both their mind and their body. It is, again, the social aspect. A lot of the things that we do also help with small dexterity, working on their memory, and lots of fun. So it's just keeping them occupied with things. Some things may be new to them that they never tried before, and so that's good. New is always good. Scary, but good.
And Charlene, with Embrace, you guys, this is very important to you, obviously, making sure people are educated about assisted living opportunities. Why is this so important to your company?
Because we consider assisted living their home. And if we have to see a patient that is hospice appropriate and they're in assisted living, we go into the assisted living and realize it's their home. And we want to provide the best medical care so that they can enjoy every activity, and we encourage that. As hospice is about living and not dying, we get to go into the assisted livings and help them have the best medical care so that they can participate in whatever activity. Maybe it's yoga at 9 o'clock in the morning, or maybe it's going to the restaurant on the bus trip. And we can do that. And just because they're on hospice doesn't mean they can't continue that. And the socialization part is really great, because for us that go into homes, sometimes they're all alone and we worry about them.
Yeah.
When they're in the assisted living, we feel comfortable when we leave them because we know that their caregivers are there for them.
Somebody's checking on them
Right.
at all times. And you made a very good point there with your statement about, you know, living, not dying. And it's really important to not get in that situation where you become shut in, essentially, and it doesn't allow for you to do that.
Yeah.
And we're going to talk about a little bit more coming up. We've made some really good points. I want to talk to you, Dave, some more coming up after the break about how we start to get into the process of going into assisted living. We're going to cover that. And we're also going to talk a little bit about the costs and what's associated with that. Charlene will share with us some of the medical things that you have to go through when you're looking at assisted living facilities. Stay with us. We'll be right back, and we've got lots more to come.
Many people think that because you've been referred to a hospice services that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
Welcome back to Embracing Senior Health. I've got some great guests with me today. We've been having a wonderful conversation about who should be looking at assisted living, and we're going to talk now about the differences between assisted living and also independent living. So Charlene, tell us a little bit about that and really what the difference is there.
Well, I can tell you by firsthand experience, my parents, when we moved here, they had to come with me because I was the only one, and they came to an independent living. And they were able to take care of themselves, all of their needs. You can even drive in an independent living. You would have community meals, community housekeeping, but you had to do your own laundry, you had to take care of your own apartment, and your own medications. So those people are pretty much just living in a senior community for the support of having somebody there 24 hours a day.
But moving forward, saying that assisted living is beyond that, Dave, tell us a little bit about the difference there. So your facilities in general, like yours, when it comes to assisted living, is exactly what?
Well, as we said originally, like people who go into independent living, mostly what happens is they may have one meal a day provided by a community, and some of them even live in little cottages outside and look after themselves, but they're under the umbrella of the community. So there will be a check on them, you know, to make sure they're okay. As you move into assisted living, you know, we have like 24-hour coverage. So there's always somebody there at night to, you know, check on people and make sure they're okay, they haven't fallen out of bed or something like that. Mm-hmm. And like during the day, well, you do have it's a regulated amount of staff you have, you know, per resident. You have to have so many staff.
Okay. And so, Janice, who should be looking again at assisted living?
I think once you're starting to have questions and concerns about your loved one's safety or well-being, whether it be just lonely, but needing, you know, some kind of assistance, there's usually a big influx of calls, primarily around large holidays, to where people can hide things on the phone, but when you go to see them and then you're spending that time and seeing, okay, well, I see a whole bunch of stuff piled over there. I think they're supposed to be taking their medicine, they're not. Seeing weight loss, you know, seeing the forgetfulness. Certainly, it really just takes one catastrophic event to say, I should have done something.
And what specifically are the questions that we need to be asking when we're looking at assisted living? What questions should we be coming to you folks and saying, you know, what are the right things and what should we ask?
I think you should be asking, first of all, that we've gone over a couple of times, is are you going to, you know, be able to give medication? Because a lot of times that's what is, you know, the residents are forgetting to take the medication. And that can create a fall, you know, and the worst thing that happens is the people come to assisted living after they've fallen, when it could have been avoided. So the point you're really trying to get to people is to say, when they come in to ask, is, you know, you can ask, how many staff do you have? You know, what is it going to cost? What service do you provide? You know, how are you going to make my mum feel comfortable? And they're all the things, and that's a biggie, is to say, you know, they've got to feel comfortable, because, as I said before, they're moving out of their house into smaller rooms, you know, from like 2 or 3 rooms rather than the whole house.
Yeah, they've got to condense it. So, Charlene, how do we have the family discussion? What do you recommend when we know that it's time for mom or dad or an aunt or an uncle or whomever it is in our life to go into an assisted living facility? How do you have that tough conversation?
That's a real difficult thing, because you know, the role reverses as our parents get older and we're younger. It's now we're the parents, and my mother used to say that, you're the parent now. And that's really hard. It's not only hard for them, but it's hard for the child, because you really want to let them be independent. I think you have to do it very slowly, diplomatically, and almost bring to their attention that I can see these things, and give them some concrete things. You know, you're not taking your medicine, the garbage is not being put out, you know, and I see that you do better when we're around. So maybe you would do better when you had people around you.
Well, definitely, those are some of the things that we want to look at. And again, it is a difficult decision, but it's a very important decision that we all have to consider and make at some point in our life. And it's probably going to be for someone else first, so we're going to go down that road. So coming up after the break, we're going to be talking about the costs and the process of actually being accepted to an assisted living facility. So stay with us. We've got much, much more, but again, the costs, so very important. Stay with us.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
Welcome back to Embracing Senior Health. Today we're talking about assisted living, and now it's time to talk about the costs and some of the medical requirements. And so tell us exactly what are we looking at with costs? I mean, we don't have to do exact numbers, but there are some things. I know people are wondering about coverage.
True. All of the assisted living facilities do have what's called an entrance fee. That does vary quite a lot. It is a non-refundable fee. It doesn't go towards your first month's rent. It doesn't go into a security deposit. It's just an entrance fee. And then typically there's a room rate and a care charge. The combination of that is what your monthly bill is. So that can vary. Trying to talk about this, we have a flat rate, so we don't have care points, but
Gotcha.
but most of them do.
And then Charlene, real quickly, there are some medical requirements that they have to go through.
Yeah, they have to go to their doctor and they have to fill out a medical form saying that they are at the assisted living level of care, and that they can go in there without needing any nursing care 24 hours a day.
And it's very important to do your research on those. And thank you for joining us for this edition of Embracing Senior Health, brought to you by Embrace Hospice. Join us every Friday at noon right here on WMBF News.